Alaikum. Article of this week is titled Influence of an Audiovisual Resource on the Preoperative Anxiety of Adult Endodontic Patients. It's a randomized controlled clinical trial conducted by Craveiro et al. From Brazil in University of Sao Paulo and published in Journal of Endodontics in the year 2020. The expectation of undergoing endodontic treatment can cause anxiety in patients. Anxiety is described as a transient emotional state closely related to pain, fear, and imbalance of the organism. And responses to anxiety and fear include physiological, behavioral, motor, and cognitive changes. Dealing with patient anxiety requires different management strategies. Pharmacologic and non-pharmacologic resources have been tested to alleviate and reduce dental anxiety. So the aim of this study was to evaluate the influence of an audiovisual resources on the preoperative anxiety of adult patients undergoing endodontic treatment. 160 patients were selected for the study after applying the inclusion criteria, namely needing primary endodontic treatment, being 18 years of age or older, signing a free and informed consent form, being normoreactive, and having filled out the proposed questionnaires completely. And for the assessment instruments, the participants' general level of anxiety regarding dental treatment was assessed by the Dental Anxiety Scale. This instrument is composed of 4 multiple choice questions, each with 5 alternatives related to the patient's general reactions to a dental visit and to procedures that might be performed on said visits. The scores attributed to each alternative range from 1 to 5, with 1 point attributed to the first alternative and 5 points to the last. And the second instrument used to assess the level of dental anxiety was a visual analog scale, with scores ranging from 1, which is no anxiety, to 10, the maximum anxiety. There was a 10 minutes time interval between time points A and B, and patients from the experimental group received a tablet computer. They were then instructed to choose freely any audiovisual resource from a video sharing website, which is YouTube. And during the same period between the time points, the participant from the conventional group remained alone without any contact with the researcher, student responsible for administering the treatment, or the staff. Now, moving to the result, the application of the Dental Anxiety Scale instrument revealed that the patients were predominantly slightly anxious, with a percentage of 41.9%, followed by those who were very slightly anxious, 34.4%, and moderately anxious in 18.10%, and finally extremely anxious in 5.6%. And the likelihood ratio test revealed no significant difference between the groups with respect to the demographic and initial dental data. However, an analysis of the scores obtained by the participants in the Dental Anxiety Scale instrument revealed that the women were significantly more represented than men in the moderately and extremely anxious categories, and there were no significant difference between the experimental group and conventional group with respect to the variation observed in systolic blood pressure, diastolic blood pressure, and heart rate between the 2 assessment time points. However, application of the visual analog scale revealed a significantly greater reduction in anxiety levels in the experimental group compared with the conventional group. In conclusion, the understanding and appropriate management of anxiety are essential to treating patients successfully, not only regarding endodontics but also dental care in general. And further research using different experimental settings is warranted to address these issues and to assess the potential benefits of an audiovisual resource for intraoperative anxiety and to evaluate its overall effectiveness in helping to produce a more friendly and relaxed environment for adult patients at other stages of root canal therapy.